Late Night Health continues. My name's Daryl Wayne, sitting in for Mark Alyn. Mark Alyn, at a convention this week, he's going to learn something and come back, and we're going to ask for a report. Back in the old days, it's going to be double-spaced, and we're going to redline it and spell check it and send it back to him and have him correct it, and then he's going to send it back again. We're going to go through and see if he actually learned something while he was gone. Here's hoping. We're at our segment that we do weekly with Dr. Paul Corona. Dr. Paul down in Laguna Niguel, California. Dr. Paul, how are you this week?
Great, Daryl. Great to be here again.
It's great to see you. And actually, Paul Skypes in, so literally we do get to see each other each and every week, and it is nice to see you in your office there. And this week we're going to talk about a little bit about the relationship between physical health and brain health and how they affect each other. Paul, there's obviously a positive correlation between the two, correct?
Right, because if you think about the brain, when people say mental or a mental problem or a brain problem, the brain is, I would argue, is the most vital organ of the body, along with the heart. So with brain health, brain is the body, and so physical health is mental health.
Back in the old days, they had really crude methods of people that had what they consider to be brain disorders. I mean, I'm talking about electroshock, I'm talking about lobotomies, I'm talking about institutional settings. I mean, we're talking cuckoo's nest, right? Right.
Well, back in the day, back then that's really all they knew. And if you think about it, really, with neuroscience and brain health, we really have learned a lot about the brain in the last 20, 30 years. Before that, we didn't really have the technology to understand what was actually going on in the brain that was causing these mental problems. So back then, lobotomies and ECT and things like that, crude things like that, really were all they had, and that's all they knew back then.
So the goal of some of those crude methods was just to settle somebody down to the point that they no longer suffered?
No longer suffered, or took care of one problem, or maybe took care of the psychosis. But then the problem is people became kind of like vegetables in a way. Especially with doing lobotomies and sometimes with ECT, it would take away people's normal emotions and not just the abnormal emotions. And
there are drugs out there that kind of did the same thing as well, correct?
Right. There were cruder drugs back then some of them are still available, but the medication choices we have available now are much, much better than the older ones that used to be too sedating or cause a lot of side effects. But things have advanced quite a bit. I've been in practice about 23 years now, and so since the beginning of my practice till now, we've had so many newer and better medications that have come out.
Yeah, I went through a drug, an alcohol rehab facility before you started your practice. I went through 29 years ago, and they said that the success rate for the first time through was 15%. Well, I was one of the 15%ers. I've never had a drink or a drug since. But some of the old-timers that had been around a long time, this was at St. John's Hospital in Santa Monica. It was St. John's CDC, used to refer to some of the old-timers that had been through several times that they had what they called the Thorazine shuffle, right? I mean, right. Thorazine was some sort of a drug that just sort of knocked you out. If you were standing, you were not very mobile. Right,
and Thorazine is a kind of a crude antipsychotic medication that nobody uses anymore. But again, that's what they had back then, and it worked very well. But since then, when it comes to antipsychotic medications, the newer ones that are out now are really fantastic and not anything like the older ones.
So let's jump ahead 30 years, 35 years. No more lobotomies. I assume that they don't do that anymore as a procedure. No. Electroshock therapy is out as far as the cuckoo's nest style of doing those things. Thorazine's no longer used. What are the symptoms probably haven't changed that drastically.
The symptoms haven't changed, but just the way we have of diagnosing and treating these symptoms are much better. And medications, the right medications, really, what they do is they balance the person's brain. And so if the brain is out of balance chemically, and that's what happens, and the medications work by rebalancing a person's own neurochemicals. So if they're out of balance, the medications can help, and they actually help to really kind of fix the problem that's caused for reasons that the persons can't help.
We have a woman coming up during the next hour that's going to indicate that there's an important balance between the brain and the gut, right?
Oh, absolutely.
That there's the vagus nerve running between the brain and the gut. That if that is cut off, that the gut can go ahead and make more decisions for you than the brain
right.
sometimes, and that having those two items in the nerve endings in the gut and the nerve endings in the brain imbalance is extremely important.
And this is what can lead to irritable bowel syndrome and certain bowel problems. Because if we think about stress, when we're under stress, it causes some cramping, bloating, diarrhea. So why would an emotion cause a change in the bowels? Because of the brain body connection. And because if you think about it, where does the brain go? It goes everywhere in the body. It goes to the gut. It goes to our muscles. It goes to all of our organs. It goes everywhere. Our fingers and toes. This is why there's so many physical symptoms associated with emotional symptoms.
Well, I mean, one of the conversations that people had when they termed alcoholism to be a disease, right? Saying, why can't you just control yourself? Saying, well, if you think you can control a disease, the next time you have diarrhea, just control it, right? And,
right.
If you think that brain disorders or brain problems aren't really diseases, right? Next time you have diarrhea, which is a disease as well, just control it, correct?
Right. There's this notion that when it comes to emotional symptoms, or taken, like you said, alcoholism or drug addiction, that it's all your will, and if you just have a strong will, you could beat it. But sometimes it's not quite that simple.
Well, certainly.
That certainly helps. Having a strong will certainly helps. But a lot of these things that happen in our bodies, whether it's fibromyalgia, irritable bowels, a lot of these things are really not within the person's control. It's the brain imbalances that fuel these physical imbalances.
So what are some of the modern day cures or the kind of drugs or the kind of therapies that are used instead of the old barbarian methods that we've talked about up until now?
Well, in addition to cognitive behavioral therapies, psychotherapies, things that a therapist can do, medications that I work with are typically two main classes. One is the antidepressant classes, which there are about 4 different classes of antidepressants. But they don't just work on depression. They also work on anxiety, and they work on physical problems in the body too. And there's a lot of really good modern ones that are out there. And the other class I work with a lot is mood stabilizers, which help with severe depression, bipolar disorder, cyclical mood changes, more of the severe problems. And I work with ADD medications and a couple other things, but most of them are one or the classes. But again, I think that when it comes to depression, people misunderstand, because most people who are depressed present with symptoms of anxiety and stress.
So there must be some indication when you sit down. Is there an indication when you sit down with somebody about the severity of what they're going through? I mean, do you know from speaking to someone how far this is going to take them down the path, or do you know whether it's an extreme condition or a lighter condition, or does that only come out over time?
Well, it's all in what I do in the field of psychiatry. It's all history. It's all basically based on not only what the person tells me how they're feeling at the moment, but their whole history. So I go back to childhood, adolescence, early adulthood, and I kind of walk through different phases of life, when the depression started, how it's changed over time. So I spend at least a good hour with a new patient to try to really weed through all the different factors, whether there's traumatic factors. I mean, what are the stressors involved in the person's life? Is there any recent deaths in the family? Job losses? You know, it really breaks down to three main factors that contribute. Genetics is a biggie. Genetics is a key component. Phase and time of life is important, so where the person is in life. Midlife is a very common time that we see problems, and stressors, life stressors. So really, it's a lot more subjective. Certain areas of medicine we have blood tests and scans. In this area of medicine, it's much more subjective, and it's based on me developing a relationship with patient and understanding and knowing them, and then figuring it out over time.
Are you a fan of Breaking Bad, the series Breaking Bad? Did you watch that?
It's fantastic. I watch it all.
Yeah,
yes.
Yeah. Somebody.
It's a great series.
Yeah, I didn't really watch it when it was on, but somebody had suggested it, and we watched it on Netflix. And I think we watched it the entire series over 2.5 weeks, and then we watched it again.
It was 3 weeks.
Yeah, and then we watched it again. Right, we watched it like 3 times all the way through and got something else out of it every time. And talk about, you know, someone that had a fairly normal life, right? And then, you know, and then switched, right? Something switched inside of him in the Walter White character. And Vince Gilligan, who wrote and produced the show, said, I'm going to take you on a journey. I'm going to take you and develop these characters that you like, and I'm going to turn them really bad, and you're still going to like them afterward, right? And that's right. What happened. And, you know, I think that's kind of what you're talking about a little bit, you know, in terms of modification of people's behavior and the way they are, you know, where something changes and something snaps and all of a sudden they go in a different direction, you know, and how far will they go? What will they do? We'll talk a little bit about that, and also we'll wrap up with Dr. Paul Corona this hour on Late Night Health in just a few minutes. Go to our website, it's latenighthealth.com. Go to his website, drpaulcoronamd.com. It's me, Daryl Wayne, sitting in for Mark Alyn on Late Night Health, latenighthealth.com, and we're on Facebook, facebook.com/Late Night Health. We're coming right back with Dr. Paul D. Corona, MD, on Late Night Health.